I don't want to get too crazy about liver or pancreas function and liver disorders. However, when I used to work in acute care, I did see a lot of people with liver dysfunction and acute pancreatitis, cholelithiasis, can't say it. So you do see people with this. Obviously, we're not treating them directly in physical therapy. We're working on functional mobility, but it is good to know about a lot of these disorders. The primary focus on the boards is going to be on cardiopulmonary diseases, but liver and pancreas and gallbladder are fair game. So anyway, we're just gonna hit the high points. Probably gonna do it in two parts: liver in one part and pancreas and gallstones in the other part. Um, just some little learning objectives. We have some case studies that go with these. Um, the liver itself is cool. It's our body's chemical factory. We're processing a lot of our chemicals. A lot of the drugs that are used for medications are processed through the liver. Other drugs are processed through the liver as well. And the liver is arranged in these lobules, these arrangement of cells that are repetitive throughout the liver. So the interesting thing about the liver is it can heal itself a lot, and some of its problems result from the fact that it regenerates cells. But so it's really interesting. We're not going to go into detail on liver function, but we are going to talk about diseases of the liver. So one of the most common ones is hepatitis, and anything liver is hepat. Um, and so hepatitis is inflammation of the liver. So there are lots of different things that can cause inflammation of the liver. And of course, we think a lot of times of viral hepatitis, which is a bloodborne pathogen. There are different types, and we'll talk specifically about the different types. But there are vaccines for a lot of them, and most healthcare workers are vaccinated against hepatitis because we're more likely to be exposed to other people's body fluids than the average person. But it's not like a respiratory virus that you can catch from droplets. You have to be exposed to somebody's blood in order to catch hepatitis. So you can be in the room with somebody with hepatitis and you're not going to catch it from them unless you share blood. So that's good. There's also alcoholic hepatitis, which is also called fatty liver disease, and from excess alcohol use over time. It takes a long time to get it that bad. Idiopathic fatty liver, which that's a drag. They don't know what caused it, but there you go. Viral infection anywhere else in the body can cause hepatitis because the infectious agents might be getting processed through the liver, and chemical or drug toxicity. So any drug or chemical that is being eliminated through the body is often broken down in the liver first and then sent to the kidneys for elimination. Any drug that's being used to treat something is a lot of times processed in the liver before it's released out into the bloodstream. So the liver is highly vascular because it has to do all this processing. So liver trauma, lacerations, and things like that can be life-threatening. Liver also produces a lot of heat for our body. So some of our internal body heat is produced by the liver, which is kind of nice. It lives kind of right up under our ribs on the right-hand side, and the gallbladder is nestled underneath it. So we'll talk about the gallbladder in a minute. You can't live without a liver. That's the other thing. If your liver goes bad, you need a new one. And it's not like you can always decide, like, oh, I don't really like that liver, I want a better one. You get what you get with organ transplants. So if your liver goes bad, you need a liver transplant. So viral hepatitis, the cell injury results from inflammation and necrosis of liver cells. The degrees of inflammation and damage may vary. Some people that have long-term viral hepatitis have sort of remission and exacerbation phases. The liver is edematous, so swollen and tender. Lots of different hepatitis viruses. There are vaccines for the first three. which are the first most common ones, and avoid other people's blood. That's the best way not to get hepatitis. The signs and symptoms of viral hepatitis is fatigue and malaise. That's the signs and symptom of everything, right? So that's pretty vague. Anorexia and nausea. You don't feel like eating and you're nauseous. General muscle aching. So at this stage, it could be anything, right? We don't know. Then we go into the onset of jaundice. That's our clue. Once we get jaundice as a symptom, which is yellow skin and yellow eyes, that is telling us something's going wrong with the liver. So light colored stools and darker urine is an indication of viral hepatitis, and liver tender and enlarged with mild aching pain. In the recovery stage, you get a reduction in signs, but the weakness that goes with viral hepatitis can persist for weeks afterwards. And then once you have it, the virus can stay in your system. So like I said, you can get that remission and exacerbation phase. The only body defense against hepatitis is, well, not getting it in the first place, obviously, but formation of antibodies via vaccination. So the treatment of it is supportive measures. So resting, diets high in protein, carbohydrates, and vitamins, and that's to regenerate those liver cells. Chronic hepatitis is sometimes treated with interferon, which is given by infusion. It decreases viral replication, but it's only effective in 30 to 40% of people. So they usually use a drug combination with interferon plus an antiviral drug, but get vaccinated and avoid other people's blood. That's the main way to not get hepatitis. A lot of times people in healthcare settings get exposed to hepatitis through accidental needle sticks and things like that. So a nurse is starting an IV and accidentally gets stuck by a needle with contaminated blood. So that's why we have standard precautions, which is assume all blood is contaminated unless assume all blood is contaminated and avoid getting exposed to it. So these are all the different types of viral hepatitis. I'm not going to go through the detail on these. Just suffice it to say, there's a vaccine available for hepatitis A, and it's usually given to food care workers and healthcare workers and people who are traveling to areas where it's more prevalent. Hepatitis B, there is a vaccine available, and it's routinely given to children as part of their normal vaccines. Hepatitis C, C, D, and E, there are not vaccines for them, and so avoid them. Some of them are transmitted by, most of them are transmitted by blood. Some of them are transmitted by the oral fecal route. So hepatitis E is oral fecal. So that contaminated water, contaminated food, that's a problem. So toxic or non-viral hepatitis. So there are lots of hepatotoxins that can cause damage or inflammation or necrosis of the liver. Certain drugs that are listed there, some chemicals, ethanol, that's, alcohol. The toxins have a direct effect on the liver. Non-viral hepatitis can result from a sudden exposure to large amounts of a toxin or from long-term lower dose exposure. So people who are long-term alcohol abusers, that's the long-term low dose exposure. Or if you're on some sort of medication that you take for a long time. So alcoholic liver disease is it results in cirrhosis, which basically is progressive destruction of the liver. There are other types of cirrhosis that are linked to chronic hepatitis and some immune disorders, and there's a metabolic cirrhosis, but alcoholic liver disease is the most common cause of cirrhosis. you get, because the liver is always building itself back up, you start to get fibrosis where you don't have functional tissue, you have scar tissue, and it interferes with the blood supply, and you might get backup of bile, which can then cause hepatitis. You get loss of the lobular organization. So the liver's very organized. Those lobule cells are in those little hexagonal wedges, basically. And so when you get all that fibrosis, you get loss of the organization. And so the degenerative changes might not show up as symptomatic until the disease is well advanced. So the way they tell the extent of the damage is by liver biopsy and then by blood testing, serologic testing. So alcoholic liver disease, in the initial stages, it is asymptomatic and reversible. Isn't that nice? And the way you reverse it is by reducing your alcohol intake. In the second stage, that's where you get more of the fibrous tissue formation, and it's an irreversible change. You can't undo scar tissue. And you get more cell necrosis. In the first stage, you just get some enlargement of the liver. In the third stage, which is considered end-stage cirrhosis, anything end-stage is never good, right? But fibrotic tissue replaces the normal tissue, and so there's little normal function of the liver. So here's the thing. If you don't have normal function of the liver, you can't process medications. You can't process chemicals. It upsets your blood chemistry. It can upset glucose metabolism. It can upset protein metabolism. You can end up malnourished and with a lot of problems if your liver's not working. So this is a bad place to be in end-stage cirrhosis. You get decreased removal and conjugation of bilirubin, which is a byproduct of the breakdown of red blood cells. You get decreased production of bile. You get impaired digestion and absorption of nutrients. That's what I was talking about with the malnutrition. You get decreased production of blood clotting factors. That could be a problem. Impaired glucose and glycogen metabolism, impaired conversion of ammonia to urea. So that can upset the chemical balance in your body. It can decrease the inactivation of hormones and drugs, and so they stay longer in your system. You have to really carefully monitor drug dosages to avoid toxicity. And there's decreased removal of toxic substances in your body. So when I was a kid, my dad always wanted you to eat liver. Like when he was a kid, they thought it was good for you. And so once I took my first anatomy and physiology class, I'm like, do you know what the liver does in the body? You don't want to be eating that stuff. So, anyway, on to more on topic things. You get also inadequate storage of iron and vitamin B12, and that can cause problems, anemia type problems. You get congestion in intestinal walls in the stomach, which impairs digestion and absorption, and development of esophageal varices, which can cause hemorrhage in the esophagus. So this is a bad scene. It's a bad chain of events. Eventually, you develop ascites, which is an accumulation of fluid in the peritoneal cavity, and it causes abdominal distension and pressure. So, when you're working with someone in the hospital who's at this stage, end-stage cirrhosis, you might not be able to put a gait belt on them because of the abdominal distension, and it's uncomfortable. So the initial manifestations are vague. Like I was saying, it's everything, everything has fatigue and anorexia and weight loss and anemia. Well, maybe not anemia, and diarrhea. Dull aching pain can be present in the right upper abdominal quadrant, which is where the liver is. In advanced cirrhosis, you get that ascites, which is the buildup of fluid in the peritoneal space, and peripheral edema, increased bruising because of decreased clotting factors, esophageal varices, which can rupture and lead to hemorrhage and circulatory shock, and jaundice and encephalopathy. So that's never good when your brain is affected. And so the end stage of cirrhosis is not a pretty thing. The treatment of it is to avoid alcohol or whatever specifically caused it. So some of the some other chemical exposures can cause it besides alcohol. Supportive or symptomatic treatment, dietary restrictions, balancing the serum electrolytes. So you might need electrolyte supplementation. Paracentesis, which is draining the fluid out of the peritoneal space. Antibiotics to reduce intestinal flora, and emergency treatment if esophageal varices rupture. And once it gets really bad and you don't have a functional liver, it might have to go to liver transplantation. So liver cancer, it's never good. Hepatocellular carcinoma is the most common primary tumor of the liver. It's more common in cirrhotic livers. So you have that tissue necrosis. Things go ugly when you have tissue necrosis. You can get secondary or metastatic cancer that arises from other areas that are served by the hepatic vein, and they spread along the peritoneal membranes. So just metastasis from other sites. Initial signs of liver cancer are mild in general. So unfortunately, with digestive system cancers in general, and liver and some of the other ones, a lot of times, because the initial signs are mild in general, you don't realize there's something terribly wrong until you're in the advanced stages. So if it gets detected early enough, chemotherapy or lobectomy, where you remove part of the lobes of the liver, or radiofrequency ablation. But because of the late diagnosis, it doesn't have a very good prognosis. So this is common with digestive system cancers.